Good evening to everyone and welcome to today's session. I wish you're all very charged. Today morning, Akhilesh could be able to come to the top and just bagged the 40,000 rupees worth of subscription with 65 full-scale grant tests, 3,000 video lectures, everyday evening live online interactive sessions, and Q scanner, 1 lakh slides of PowerPoint notes, everything as a prize. So every quiz, every day we have 3 quizzes, and we want to give out almost 1,20,000 rupees worth of subscription to those who are energetically participating. But it doesn't matter that you need not always be on the first rank. To participate, to compete, to know where you need to improve, and remain enthusiastic in preparation and preparing throughout the day and showing that perseverance. If this quiz is able to inculcate those habits that make you to become achievers of that excellence, then I am successful in being all your mentor. So with that preamble, let's make the great beginning. Are you ready for the game? Yes, sir. Yes, sir. We are ready. So please take out kahoot.it, and it will ask you for a pin. And I'm giving you the pin. So today's quiz is ophthalmology. Come on. 631861. Keep punching the quiz pin and then join the quiz doctor. Sarvendriyanam nayanam pradhanam. Of all the sense organs of the body, eyes are the most precious, most essential. Even for the NEETPG entrance exam also, ophthalmology is one of the major speed breaker. There are about 15 questions asked in ophthalmology in NEETPG exam, even in FMG. You can easily score 15 out of 15, provided you have revised at least those 70 hot topics, which are the most often sought out topics by the examiner. So, Dr. Bahu, Priya, Prati, Abhijit, Shweta, Karthik. Shweta just missed in the morning quiz. I wish this quiz you will play with that all spirit of vengeance to win over. Chandra, very good. I'm able to see online a good number of you. Even those who are a little late, please inform your friends to join. So afternoon 2 o'clock is something like a relaxed time, postprandial drowsiness. I know, but with a cup of tea in your hand, if you're playing a quiz which is pumping your adrenaline, wow, that should drive you to identify those topics which you are not really doing good in ophthalm and those which are already good with. So let's make the great beginning, doctor. 22 players. Anybody else? Our ship is starting. Our ophthalmology ship is about to start. Very good. Ram Brahma Reddy also joins. Late but latest arrival. Chalo, hum door close kar rahe. Oh, the aeroplane is taking off. Very good. After this also you can catch up the aeroplane, no worries. Now, doctor, 3, 2, 1, ready. Beta adrenergic agonist. What is the effect of beta adrenergic agonist on the aqueous humor, intraocular pressure? What is the effect? Oh, 2 of you are able to win the jackpot. Let us see who are those 2 wonderful guys. Very good. Karthik, Pravalika. Karthik answered very fast, and that's how he is able to score the highest. So, doctor, you should remember, beta adrenergic agonists like epinephrine, they decrease the intraocular pressure. Even though they have a tendency to increase the aqueous humor production, they also increase the uveoscleral outflow. So that is the reason, though they increase the aqueous humor production, since the outflow is improved, you can use epinephrine to decrease the intraocular pressure. So please don't forget, doctor, glaucoma drugs is the favorite topic of the examiner. We can't afford to do it alone. Which extraocular muscle is surrounded by a contralateral brainstem structure? A contralateral brainstem subnucleus. Which that means my right extraocular muscle by my left brainstem nucleus. Which one is that? Beautiful question. Very good to see 28 online students. Very good. 6 of you have answered correctly. It is the superior rectus. Excellent. Shweta comes up. Closely competing with Karthik. Karthik missed the bus in this question. So what are you going to remember for tomorrow's exam? The third nerve palsy nuclear lesions, they typically lead to contralateral upgaze palsy. That is what you need to remember. Contralateral. A 19-year-old woman in the 7th month of her first pregnancy presents to the ophthalmologist, complaining of visual loss. What is the potential possibility in a pregnant woman to have such kind of visual loss? Very good to see 31 online students. Please post in all your social media groups about our daily 3 quizzes and almost 1,20,000 rupees worth of prizes to be won, and invite more and more of your classmates. Very good. 7 of you are right. It can be central serous chorioretinopathy, ischemic optic neuropathy, exudative retinal detachment. Anything can happen in a pregnant woman that can lead to this kind of a clinical presentation. Wow, Sweta. Very good, Sweta. I'm so happy for you. Jyoti is the highest climber. Ravi also. Karthik, come on Karthik, after that first 747. You are not wielding the sword, right? No worries, no worries. What is wrong statement about the visual pathway? Visual pathway. So for the next 6 months, if you are attending the quiz with Dr. Murli Bharadwaj, TID 3 times daily. Nobody is going to stop you from taking the NEETPG examiner into an onslaught. Very good. 10 of you are right. It's a relatively simpler question. Cones play a predominant role to perceive the form sense. The form sense is most accurate at fovea. Visual acuity is the capacity to see the fine details of the objects. Snellen is not for sense of contrast. Snellen is for visual acuity, is what you need to remember. Whoa! Karthik once more taking back the sword. Very good. Milky is the highest climber. Excellent, doctor. Excellent. So visual acuity is measured by Snellen's chart, acuity grading, and Vernier's acuity localization. Now, doctor, an ophthalmos you see in Horner syndrome, no? What is it because of? It is due to the paralysis of what? I want to see 50 plus online students in this afternoon. Journey to victory. I think most of you will correctly answer this. Not a very challenging question. In ophthalmos, in Horner syndrome. Whoa, I told you, most of you will correctly answer. No, it is not levator palpebris superioris. Levator palpebris superioris lead to ptosis in oculomotor palsy. Whereas in Horner's, there is a sympathetic palsy. Muller's muscle is that supplied by the sympathetic innervation, and that leads to development of inophthalmos is what you need to basically remember. Very good. Ram Brahma Reddy is Mohan Reddy is really making a head-on collision. The most mitotically active lens epithelium cells, where are they located? Is a very, very important question. Because that makes a very important difference in cataract formation. So where are they located? So very good. Oh, only 3 of you are lucky to correctly answer. There is a ring around the anterior lens. That is the point where most mitotically active lens epithelium cells are located, is what you need to remember. Very good, Shweta. Vaibhav Agarwal is really zooming like an arrow. Very good. So, the lens epithelium cells which are located anteriorly underneath the lens capsule. So epithelium cells in a ring around the anterior lens, it is also called germinative zone. That is the one which shows highest amount of DNA and most mitotically active cells, is what you need to remember. Which of these structures is most sensitive to radiation? फिलहाल MCQ तो easy दिख रहा है, answer भी easy डालो. This is 1 point that you can score. Most sensitive to radiation. Punch, punch, punch. So every day if you are practicing MCQs in a very playful, gamified way with Dr. Murli Bharadwaj, tomorrow NEETPG exam also, जरा दिल को हल्का बना के जाना पड़ेगा. You should not go to the exam as such. It is a life and death issue. That's the reason they call it as sportiveness. One should be very sportive. So during preparation, playing table tennis or playing carom board or playing tennis, some sport, every day if you are playing, no, that give and take, that practice should come up. Because tomorrow when you are a consultant also, all patients will not survive. Sometimes you feel, ayyo, I lost this patient. Someone came with gram-negative sepsis with complete capillary permeability, with severe hypotension, with a renal shutdown, with a azotemia, already brought very delayed, already acute tubular necrosis is there. You may be from All India Institute, you may be from PGH Chandigarh. What can you do? You cannot be able to. Only you can give your shoulder for the patient's attendant to cry on your shoulder. So every aspect of our life, to be sportive, to take the things in the way that they happened, and at the same time to not disappoint. That is the most important spirit to win any game, doctor, let me tell you. So it is not about knowledge, it is more about wisdom, common sense, stability, ability, nobility, and agility. That is the thing that matters the most, which you will get the practice by playing quizzes with Dr. Murli Bharadwaj. Very good, Shweta. Dr. Bahubali is coming. He's the highest climber. Very good. Now, you should remember, the lens is most radiosensitive component of the eye, followed by cornea, retina, and optic nerve is what you need to remember. Which feature is consistent with the temporal lobe lesion? Temporal lobe lesion. So you are given seizures, optokinetic nystagmus, formed visual hallucinations, and congruity of the visual field defects. There are multiple things to select. So whenever there is a temporal lobe lesion, which features are consistent? Very good. 5 of you are correct about seizures and option 3. So, very good. That makes Jyoti and Meera to rise up. So, doctor, you should know, optokinetic nystagmus indicates that there is a lesion in parieto-occipital or the frontal lobe. If the lesion in the optokinetic nystagmus, if it is there, you are moving a moving strip and you are observing the nystagmus. So, slow phase pursuit abnormality is there, means it is parieto-occipital lesion. If there is a fast phase recovery abnormality, means it is a frontal lobe lesion. And always a high congruity of the visual field defects. A visual field defect can be congruous, incongruous. High congruity means the more posterior, that is the lesion is in the occipital lobe. Once more, doctor, in the online mbbs.com video library, we have an excellent discussion of ophthalmology. Almost 30 hours of ophthalmology review discussion is there, both theory and also MCQ based discussion of the past AIMS All India PGI question bank. After this session is over, please call our helpline 9000-868-356. You can see in below. And some of the students said, sir, I just missed to become the topper. You are giving topper a free subscription activation. How about us who stood in 2nd, 3rd, 4th and 5th? If you stand second, third, fourth, and fifth, 90% off. You pay only 10%, 4,000 rupees, and you get the activation. But you need to pay today itself. So that once more, every day there are 3 quizzes, right? So today only, if you pay 10% of 40,000, 4,000 rupees only, you will get the activation if you are in the second, third, fourth, or fifth position. Even you can win and you can gift it to your friend also, no worries, to your boyfriend or girlfriend, doesn't matter. So, or your very good friend's boyfriend, girlfriend also doesn't matter, right? So now, doctor, the next question. The saccadic movement, which is affected in progressive supranuclear palsy. See, progressive supranuclear palsy is called Parkinson plus syndrome. You also have dementia. So, the saccadic movement, which is most often affected, which one? You need to punch very fast so that you will rise up the ladder. So just being correct is not enough. You need to be more than correct. Very good. So downward, they cannot look down. So that is the reason in every dementia patient, you should always ask the history. In every Parkinsonism patient, you should ask the history. Is there any history of falls? When will you fall? If you cannot look down, you will fall. So if somebody with Parkinsonism features giving history of frequently falling down, you should never forget to check for the vertical downward movement. So there is often a limitation in the downward saccade in progressive supranuclear palsy, and that will present like a history of frequent falls is what you need to remember. Very good. Jyoti had the highest hat trick. So Karthik is still took away the crown of Shweta, but don't worry, Shweta has got a very, very, very high fighting spirit. So, doctor, in progressive supranuclear palsy, downward gaze is affected. And this is different from the dorsal midbrain syndrome where upward saccades are basically affected. Now, what is most likely to be an extraocular focus of infection for an endogenous bacterial endophthalmitis? Endogenous bacterial endophthalmitis, outside the eye, which organ infection can spread and lead to bacterial endophthalmitis is the interesting question. I'm so happy you're really punching very fast. Very good. Only one is able to answer this correctly. Liver abscess is most likely to be extraocular focus of infection. For an endogenous endophthalmitis is what you need to. So combo breaker. 3 players just dropped their answer streak of 3. So Karthik is still making onto the top. Now, granulomatous inflammation of the eye. All these are responsible for a granulomatous ocular inflammation, except. Beautiful question. The one who answered is going to be MD General Medicine. Punch your answers, doctor. So, very good. 5 of you have correctly said. Sarcoidosis, rheumatoid arthritis, Wundt, Koinagi-Harada syndrome. In all this, there is a granulomatous ocular inflammation, but not in Behçet's. Behçet's is non-granulomatous. That brings Meera to the top. Very good. Followed by Karthik, Jyoti, Shweta, and Ram Brahma Reddy. So, doctor, Behçet's is a non-granulomatous vasculitis. What do you get in Behçet's? Acute uveitis with hypopion, aphthous stomatitis, genital ulceration. What is the famous clinical vignette? If you see one patient of Behçet's, you will not forget. There are orogenital ulcerations. Everybody will be teasing the Behçet's guy. Hey, you have gone to the red light area. Who is the setup 2? Setup 3? Unit 2, Unit 3 for you. He will be saying, no sir, I am a God-fearing, sincere husband only living with my wife, sir. Why every doctor asks me this question? I have no extramarital, premarital, antimarital, retromarital or any marital relationship, sir. But still I have orogenital ulcers, sir. He will be praying. He will be crying. So what is the reason? The reason is Behçet's presents with genital and oral ulceration. A lot of times clinicians end up in investigating a Behçet's for a sexually transmitted disease, which is not true. So hypopion, aphthous stomatitis, genital ulceration is what you need to basically remember. The hyperpigmented area in this photograph contains the branches of which anatomic structure? Come on, doctor, punch your answer. Which anatomic structure? Typically, the hyperpigmented area in this photograph. Oh, nobody could be able to make it. It is long posterior ciliary nerve. So basically, what is being shown to you is called Axenfeld's nerve loop. Axenfeld nerve loop. That the loops of long posterior ciliary nerves within the sclera, and they are a normal anatomical landmark, is what you have to remember. Now, the next question. This exam finding of the cornea, which you are able to see, the exam finding which you are able to see, what are the conditions that can lead to it? Just look very closely into the YouTube image. You will get it. Very good. 6 of you are absolutely right. What you have seen is thickening of the corneal nerves, which happens in leprosy, Refsum's disease, multiple endocrine neoplasia type 2A also, corneal nerves which are thickened, but not in the case of the onchocerciasis is what you need to remember. So Prati is the highest climber, and that keeps Mira on the top. So doctor, you should know the list. Fuchs dystrophy, Refsum, leprosy, neurofibromatosis, Riley-Day dysautonomia, acanthamoeba perineuritis, they all lead to prominent thickened corneal nerves is what you need to remember. The retinal circulation supplies all the following layers. Retinal circulation. Yes, Alladi Vinay is saying, sir, there is a delay by 8 to 10 seconds. Yeah, there will be. That is the reason we gave 30 seconds. Actually, it should be only 20 seconds. So, very good. 6 of you are absolutely right. The retinal circulation supplies inner plexiform, inner nuclear, ganglion cell layer, but not outer nuclear layer is what you have to remember. That brings Vaibhav Agarwal onto the top. Very good. So the point that you need to carry, doctor, is the retinal circulation supplies nerve fiber layer, ganglion cell layer, inner plexiform layer, and the inner one-third of the inner nuclear layer. Whereas the choroidal circulation supplies the remaining part of the neurosensory retina, and also retinal pigment epithelium is what you have to emphatically remember in the anatomy in ophthalmology. Now you are being shown the clinical picture. So in the clinical condition shown in the figure, where does the exudates accumulate? First of all, what is the picture shown? You have to make a diagnosis of the retina. Diagnosis of the retina. Oh, 5 of you are correct. Outer plexiform layer. So what had been shown to you? Prati made a hat trick, very good, and that brings Ram Brahma Reddy Chupe Rustum Nikla. Sir, 8 to 10 seconds delay bola, magar top mein aake baith gaya. So, very good, Ram Brahma Reddy. I am very happy for you. Excellent. So, doctor, in diabetic macular edema with hard exudates surrounding the blood vessels, that is the picture that has been shown to you. Good to see Chellappa and many more, those who got little late for this ophthalmology quiz. But let me tell you, morning 10 a.m., afternoon 2 p.m., night 10 p.m. Every day there are 3 quizzes. Before day only, we will update. So today is ENT, today now ophthalmology. Tonight is SPM, sleep promoting medicine. So please tell all your friends to join this quiz. Every day we give over to the topper of the quiz 40,000 rupees worth of online MBBS.com video library, 65 full-scale grant tests and discussions, daily live online interactive session, discussions, everything. 1 lakh PowerPoint slides of notes, and what all that you require to become the topper with onlinembbs.com. It is all being given freely to the topper as a gift and a prize. And those who got 2nd, 3rd, 4th, and 5th position, still nothing to dishearten. You pay 10% of 40,000, 4,000 rupees. You get entire activation of the online MBBS.com video library, but you need to make a payment today and then buy it out. And if you already have joined us, you can still gift it to your friends, no worries. So that's how we do this. So every year, super 1,000, 350 days, 1,000 quizzes, 1,000 people are given a free online MBBS.com subscription worth of almost 3.5 crores. So now, doctor, about the condition shown in this kid, post-CT, histology, clinical picture, everything is presented. What is a wrong statement? Good to see 36 online. Very good. It is a rhabdomyosarcoma. It is one of the 2 most common primary solid malignancies in children. The clinical presentation is typically acute. Embryonal histological pattern is most common. So they're all the true statements. That brings Karthik once more shooting up to the top. So doctor, rhabdomyosarcoma and Wilms tumor, they are the 2 most common primary solid malignancies in children. And in rhabdomyosarcoma, embryonal type is the most common type, is what you need to remember. a spontaneous ecchymosis of the lid. It is seen in rhabdomyosarcoma, sarcoma, but it is not specific. Because even a metastatic neuroblastoma also can lead to a raccoon's eyes. Even the Ewing sarcoma with periorbital ecchymosis, that's the reason it is not specific. That's the point of interest. The lesions which are affecting the optic tract. So you should be very sure on the optic pathway, visual pathway, the various lesions. Definitely one question comes in NEETPG exam, doctor. The lesions affecting the optic tract, what are they associated with? Good to see. Sairam. Very good. There's a unilateral decreased visual acuity and afferent pupillary defect ipsilaterally, and a contralateral afferent pupillary defect also will be there. But it is not heteronemus hemianopia. Once more, that brings Mira to the top, and Milky is the highest climber. So you should remember, doc, pure optic tract lesions produce a contralateral afferent pupillary defect and also a complete homonymous hemianopia, not heteronemus. That's the point you need to appreciate. These are all the lesions, features consistent with parietal lobe lesion, except what? So what will parietal lobe? So lobar dysfunction is another very high topic for the NEETPG exam, doc. So there are 953 topics in the online MBBS.com video library. Take every chance to do the revision. Very good. 9 of you are absolutely right. Parietal lobe lesion lead to agnosia, right lid confusion, optokinetic nystagmus abnormalities. They're all the true statements. And that keeps Mira on the top, and Ram Brahma Reddy is apne nikalidam pratidvandvi Mira के साथ लड़ाई में आगे बढ़ रहा है. नेक्स्ट राउंड में देखेंगे क्या होगा. So, doctor, parietal lobe lesions produce inferior hemianopias, inferior quadrant hemianopias. Temporal lobe produces superior. That's the point you need to appreciate. Now, which visual field defect is most likely leading to seesaw nystagmus? Seesaw nystagmus. It is often associated with what? So you should know which lesions lead to seesaw nystagmus. See different types of nystagmus. What are the underlying lesions? One of the favorite topic of the examiner. So seesaw nystagmus. One eye goes up, one eye goes down, one eye goes up, one eye goes down. Seesaw nystagmus. 8 of you are absolutely right. And that once more brings Karthik onto the top, and Pravalika is a very fast climber. So doctor, you should remember, bitemporal hemianopia may be seen with acquired seesaw nystagmus because the posterior chiasmal lesions are often associated with diencephalic lesions, and that makes bitemporal hemianopia and seesaw nystagmus to coexist is what you need to remember. The last question which decides who is going to get that 40,000 rupees worth of online MBBS subscription. Punch, 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 doctor. The most common cause of the vitreous hemorrhage in adult population. Whoever punches fast will go up, 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 up. The most common cause of the vitreous hemorrhage in adult population. Wow, 9 of you are right. Whenever diabetic retinopathy is in the options, no doctor, tomorrow's NEETPG exam also. आंख बंद करके उसी को चूज कर लो, क्योंकि एग्जामिनर, it is one of the most highly topic lurching inside the server of the examiner. Okay, Abhi, that brings Karthik to the top. So, doctor, we should know vitreous hemorrhage caused by diabetic retinopathy ranges from 39 to 54%. One of the very important preventable blindness. Now the time to celebrate Dr. Meera Ram Brahma Reddy, Karthik, excellent Dr. Karthik. Finally, Karthik is the winner of the today's afternoon 40,000 rupees worth of online MBBS.com video library, 65 full-scale grand tests, 3,000 hours of video lectures, and daily live online broadcast sessions, 1 lakh PowerPoint slides of notes, 30,000 MCQs of Q scanner, everything that you require to become the NEETPG topper. So, Karthik, please send the screenshot to our online MBBS helpline. You know very well the phone number 9000868 and please claim your prize. Ram Brahma Reddy, Meera, and many more. You have done very well, and you can still grab this subscription activated just for a throwaway price of 4,000 rupees if you pay today, right? So once more tonight at 10 p.m. we will meet with SPM. Till then, enjoy a great afternoon, doctor. The life does not come back. So easy, so sweet, so wonderful, and we are enjoying the journey, which is most important. Ta-ta, see you once more at 10 p.m.